Hi, I'm Paul Fraser and I'm a veterinarian who's worked in practice with horses for over 40 years. And I've got Caitlin helping me today holding our horse, and the horse is Dolly. Dolly's a perfectly healthy horse but here to help us demonstrate what we're talking about today. And what we are going to deal with is strangles, because it is a disease of significance amongst all horses in New Zealand, and we want to do everything we can to control it and stop it spread throughout the country. So it's an infectious respiratory disease of horses, and it's caused by a bacterium called Streptococcus equi. The thing about it is very, very infectious, and in a susceptible population, you can get anything up to 90% of the horses can be affected with it. Although we're lucky enough, it only probably has a death rate of somewhere between 1 and 2%. Now, it's not a notifiable disease in the way that equine influenza or African horse sickness are, where they have to be notified to the MPI. So we don't have to do that, but it is a disease that we do not want in our country, and we want to control it as much as we can. So we encourage all horse owners and all people involved with their horses to actually be very honest about it, and to make sure that if they do happen to have it, the presence is known and they can do what they can to prevent it from spreading. The only time it is of significance with MPI is if your horse is going to be exported, because overseas countries usually insist that the horses that are being exported have had no contact with strep equi strangles before they are exported. And we have to sign, or the owners have to sign declarations to that effect. And it's considered a very, very serious offence if those are false declarations. So what are we going to see if a horse has got strangles? Well, it's going to be depressed, it's going to have loss of appetite, it's going to have a very sore throat, and it's going to have a temperature. There may be a development of a cough, laboured breathing, but the most important thing with strangles is we're going to get involvement of the lymph nodes at the back of the head. So there's lymph nodes below the ear, at the base of the jaw, and under the jaw. And those are basically there as filters, so they filter out the bacteria as it arrives. And unfortunately, in that process, that's going to create abscesses. So we're going to get large, painful swellings in these areas. And as they swell, they're going to lose hair, and then eventually they're going to rupture and release thick custody pus. Now, the other thing, of course, it's important to remember that that's the extreme version of strangles. There'll be some horses that basically don't look particularly bad at all, but are very mild cases, but they can be just as infectious and just as dangerous. And then we're going to deal with some of the complications that we see with strangles. So the first one is what we call a guttural pouch infection. Now, as you may well remember from humans, there's a small duct called the eustachian tube that runs from the middle ear through to the back of the throat. And that also exists in horses, but it has an unusual makeup in that it creates a large outpouching there called the guttural pouch. And that's an ideal place for bacteria to come and survive. And when they live in there, they're going to create a pussy infection, and eventually that pus is going to dry out and become little round inspissated balls, which we call chondroids. And these chondroids become a wonderful source of bacteria. So the horse can recover from all the other signs of strangles, but it can have some of these little seeds stored up in the guttural pouch, and they'll release bacteria and create a carrier state. And these are the horses that can actually transfer infections amongst what look like normal, healthy herds of horses. Now, the second complication we're going to get is one that's known as bastard strangles. So what happens here, we've got our glands that we were talking about. They've filtered out the bacteria, but a few of them have actually slipped past there and then move on around the rest of the body. And then we're going to get abscesses that are formed in different places. We can get some bad ones in the thoracic inlet here, which may well compress the windpipe, and that can be quite serious. We can get them in the groin, we can get them behind the eye, we can get them in the brain. There's all sorts of places that we can get these so-called bastard strangles. And then the third complication we're going to see goes by the unlikely name of purpura hemorrhagica. So that is a immune-mediated reaction where the horse reacts to the bacteria, and it results in breaking down of blood vessels and leaking of fluid into the tissues. So we see swelling in the lower legs, we see swelling in the nose, and we see large wheals all over the body, and some of these will actually die and fall off. Now this particular condition, purpura hemorrhagica, unfortunately is extremely dangerous, and probably 50% of horses that get it die. The good news is that not too many horses get it. It is fairly rare. So then the question arises as to how do horses actually catch strangles? So the incubation period is usually between 3 days and 2 weeks. And then the horse will begin to shed the strep equi bacteria from the nose somewhere between 4 days and 7 days as a rule. Now this is really quite important, because what we do know is that a horse will not shed the bacteria from the nose until at least 24 hours after they've had a high temperature. So if you've got a horse that's got a sore throat and a runny nose, and you take his temperature and the temperature's high, you know you've got 24 hours to remove the horse away from its paddock mates, which it may potentially infect. So that's a really important message. And then the material that actually transfers the infection, obviously the pus that comes out of the glands is very infectious. But also you'll get bacteria that will be excreted out through the nose and through the mouth, and can be transferred from horse to horse that way. The other way, of course, we can transfer that is with physical objects, which may be troughs, feed bins, it may be our hands, it may be saddlery bits, all sorts of things like that will actually transfer the bacteria. So now, of course, Strangles is a bacteria, it's not a virus. And the difference is bacteria are a lot bigger than viruses. So a virus could travel a long way on the wind if the horse coughs. Bacteria won't go that far. So to actually keep infected horses and uninfected horses separate, you only need a distance of about 5 metres. The other thing is that the strep equi bacteria lives in water for between 4 and 6 weeks. It probably only lives on rails and harder, warm structures for a few days. But of course, if you are going to have them in a paddock, an infected horse in a paddock with infected soil, you need to assume that you want to keep other horses out of that paddock for at least 3 weeks. And of course, at the same time, because we know it lives in water, you're going to clean the trough out as well. Now, we'll just briefly talk about tests for strangles. The really important thing here is that we need to accurately demonstrate whether or not the horse has an infection with Streptococcus equi. If we have false negatives, if we think the horse is okay and it's not, then we have some pretty serious consequences. So we need to get the best samples we possibly can from the horse to say that it is or isn't infected. And obviously the very best source is if we pop a needle into an abscessed lymph gland and take some pus out, that will have the bacteria in it, so we know exactly what we've got. But without that, we need to take either some swabs or some washes. So the gold standard is a wash of the contents of the guttural pouch. But that is very hard to do, and it's not practical for the field situation that we're usually working in. So what we do is we rely on swabs. Now, swabbing is a little bit like swabbing for COVID. I'll demonstrate here. What we need to do is we need to take the swab from as far back in the respiratory tract as we can get it. We need to go back here to the pharynx, and that gives us our best possible chance of finding strep equi. What we don't want to do is take a small swab and just run it around the inside of the nostrils, because that is going to give us too many false negatives, and as we were saying, a false negative is dangerous. So once we've got our samples, we then want to know how we're going to process them, and there are 2 ways of doing that. The conventional way is to plate the swabs out on some agar and to grow the bacteria in the laboratory. Now that process takes 2 to 3 days. And the reason it does is because there will be a lot of streptococcal bacteria that will grow on this agar. But we're looking for a very specific one. We're looking for Streptococcus equi. So it takes several days to run some tests to actually differentiate that Streptococcus from all its other streptococcal cousins. So that has been replaced in recent years. There's a new test called a PCR test. And what that does is that looks for genetic material, DNA material that comes from the bacteria. And that's a very specific test, and the other wonderful thing about it, it has a very rapid turnaround, so we can get that usually back within the same day. So the PCR test is starting to become the test of choice. And now I think we'll just briefly also look at the treatment of Strangles. In most cases, these abscesses that we're dealing with will actually come up and they'll ripen and they'll burst and basically cure themselves. There will be some cases where they won't actually come to the surface and they won't drain, and in those cases we may have to go in and actually surgically lance them to drain the pus from them. There's always a question of, do you use antibiotics on Strangles or don't you? And by and large we don't use antibiotics. What they will do, if you have an abscess which is half formed, it'll stop that forming, and then when you stop the antibiotics it'll flare up and go again. So we don't use it in that circumstance. When we will occasionally use them is if we know we've got a Strangles outbreak on a property and we're picking up horses with a high temperature very early on in the course of the disease before their glands have actually started to swell. And if we give those antibiotics, it's usually penicillin, we can actually stop the glands from swelling and abscessing. So it's useful in that circumstance. But never ever use blanket antibiotics over the entire property, because it will not stop the horse picking up the infection. It'll only delay the inevitable. And then if we get other complications from purpura hemorrhagica or bastard strangles, we'll just deal with those as circumstances dictate. If we're talking about prevention of strangles, there's two aspects we've got to look at. One is vaccination, and there used to be 2 vaccines available in New Zealand. There's now really only one that's commonly used, and that's one called Equivac S. And it also comes in a combination with tetanus where it's called Equivac 2 in 1. And the thing about the vaccine is it's not particularly powerful. So we need to give the first time the horse gets the vaccine, they need 3 injections at 2-week intervals. And then they need an annual booster after that. And even having done all that, there's no guarantee that your horse won't get strangles. But what it will do is, in a large herd basis, it'll reduce the number of horses who are prone to catching strangles, and the horses that do get it will probably get it less severely. Vaccination is to be encouraged. And then the second thing is management and how we manage this situation. Now, Strep equi is a bacteria which loves dirty, crowded conditions where horses are under stress. So the first thing we do is we try to minimise those predisposing situations. And then when we introduce new horses to the property, we make sure, we assume that they could possibly be carrying strangles, so we actually quarantine or isolate those for 3 weeks before they're introduced with the resident horses on the property. And some of the bigger properties, some of the studs where they have a large number of horses coming and going, they tend to run the resident horses and the visiting horses in separate groups, and that way that they do isolate each other from each other. And then the other thing that we're going to be doing is we are going to have a thermometer, and we're going to use that every time we see a horse that's got a sore throat, a runny nose, or something that suggests it's heading for a respiratory infection. And it's really important that those horses are isolated, kept away from the others until we've worked out what's going on. Now, if in the case that we do have an outbreak, the sequence of events that we're going to do is, the first thing we're going to do is step in and isolate infected or suspicious horses. The second thing is we're going to get some veterinary help, because we need to know whether we've got strangles or whether we haven't, and that's going to require veterinary tests, as we've explained previously. We're going to be taking regular temperatures, and we're going to be setting up some PPE. We're going to have try to have clothing and boots that are not going to be working with horses that are infected and then transferring to horses that aren't infected, and that's really important. So we're going to have foot baths, we're going to have disinfectant material, and probably Virkon is the easiest one to use. It kills everything, and it is a good disinfectant, so that's the one I'd probably recommend. And then of course you're also going to be disinfecting your leads, your head collars, bits and pieces that are going to be transferred between horses. We're going to separate our paddocks. We're going to separate infected paddocks and non-infected paddocks by running an electric tape down the boundary at that 5 metre interval we were talking about before. And of course we're going to make sure we don't share troughs or feed bins. And then the other thing that's going to be really important is we want to be responsible, and we don't want to spread this around the country. So we're going to be very conscious of moving horses off the infected property and potentially infecting others. So there's basically 4 take-home messages from this talk. So the first is that Strangles is very, very infectious, and you don't want to be responsible for infecting other horses within the industry or your friends' horses. So be honest and responsible if you have or think you may have a Strangles case. The second thing is that management techniques are also vital. We want to do everything we can to minimise the stress on your horse and on others. We want to have good personal hygiene, and we want to have good horse hygiene. And that's really the cornerstone for managing Strangles. The third thing is we want to encourage vaccination. It's an important tool to help reduce the incidence of Strangles within the population. We know it's not a guarantee that it's going to work, but it certainly does help, and we would encourage its use. And most importantly of all, we want to assume that any horse that we think has a respiratory condition that could possibly be Strangles is treated as Strangles until such time as we can absolutely and categorically prove that it's not.